Good afternoon. For those of you that are just joining, again, we're going to go ahead and wait another minute or so, just to allow everyone to get into the forum, into the meeting, before we get started. So thank you.
All right, we're getting a slow down on the invite. So for everyone who's just joined, if you can please make sure to put your full name, organization, title, and email in the chat box for attendance purposes, we'd appreciate it.
Thank you, Kristen. It seems like there are a couple that are still trickling in. We will go ahead and get started, though. So again, good afternoon, and thank you all for joining us today for Kentucky's Department for Medicaid Services Reentry Section 1115 Demonstration Public Forum. I'm Angela Sparrow. I'm one of the behavioral health supervisors within the department, and I will be presenting today's forum. Again, we do want to mention it will be recorded and the forum will be posted on the Medicaid's website for reviewing as well. And so that again will occur next week. This again will be the second forum as we wrap that up. So again, it can be viewed there as well. So a few housekeeping items before we get started today. Just as a reminder, as Kristen said, for a few that joined, please include your full name and the organization that you're representing today, as well as your job title. And email in the chat box so that we can ensure that we get a full record of attendance today. And again, can ensure that you all also receive any of the notifications moving forward regarding the application that we're going to speak to. Also, again, microphones are muted at this time for all participants, and we will be monitoring the chat box. If there's questions, again, regarding any technical assistance needs, all comments, as a reminder, and questions regarding the application should officially, and we do ask that you officially submit those to the appropriate email box that's displayed in the chat box today. So again, we want to ensure that we have a record of those and that we also can collect all of those questions to include in formal responses for all of the public to see as well. So just want to make a note of that. The purpose of today's forum, again, is to provide information regarding the Department for Medicaid Services, or DMS's intent to submit an amendment request to the Center for Medicare and Medicaid Services, again, also CMS, to authorize certain reentry transitional services for identified individuals that are considered to be soon to be former inmates of public institutions, as well as requests limited services for eligible individuals participating in the Kentucky Behavioral Health Conditional Dismissal Program. And we also want to ensure that everyone today is aware of the public comment process prior to Kentucky DMS submitting the request to CMS. And so before we get started, again, many of you may be aware of what a Section 1115 demonstration is. Some of you may not. Again, this may be a new term. So we do want to kind of provide a refresher of that. A demonstration project or a pilot again gives states flexibilities to design and improve their programs that assist in promoting objectives of the Medicaid program. So services and programs that are approved under a Section 1115 demonstration are services that cannot be approved under a typical Medicaid state plan. And again, it requires federal authority under the Section 1115 for states to receive federal financial participation, or again referred to as FFP. And so many states operate under some form of a Section 1115 demonstration. States can continue to amend and modify and build upon demonstrations as they go for various services and programs. Again, all demonstrations must be budget neutral, which means that during the project, federal Medicaid expenditures should not be more than the federal spending without the demonstration. So, in other words, the cost of services approved under a demonstration must be less than or equal to the cost of services that the Medicaid program spends today. So again, all states must demonstrate that budget neutrality in order to receive approval for all applications. And Kristen, if I again can't monitor the chat, so if I need to stop at any time, just let me know.
Yes, will do.
So again, also want to provide some background information on Kentucky's Section 1115 demonstration, where we are today, and again, as we talk about where we are headed. So again, the Kentucky Helping to Engage and Achieve Long-Term Health, or Kentucky Health, Kentucky's original Section 1115 demonstration was approved in January of 2018. That, again, approval originally contained the Kentucky Health Program, which was rescinded to CMS in December of 2019. That program was never implemented. It also included Kentucky's Substance Use Disorder, or SUD, Section 1115 demonstration, which was implemented in July 1st of 2019. Kentucky's 1115 demonstration originally included the out-of-state former foster care youth. And again, that was coverage for youth who were under foster care in another state that moved to Kentucky. Again, it included aligning Medicaid beneficiaries' annual redetermination with their employer-sponsored insurance, or their ESI open enrollment periods. And it also included a waive to not provide non-emergency medical transportation for methadone treatment to narcotic treatment programs. And so Kentucky received a temporary extension to extend our 1115 demonstration, which is now titled Keep Team Kentucky. And this was extended and granted this year. And so it, again, has been extended through September 30th of 2024. And that extension, again, is hopeful that it will continue beyond that date. However, with the pending amendments that we're going to speak to, again, Kentucky hopes to work with CMS on approval of all of those amendments and to kind of streamline all dates moving forward. And so again, our current demonstration includes the substance use demonstration and the coverage for the out-of-state former foster care youth. And so, as we mentioned, Kentucky does have a few pending amendments under review with CMS. And so those pending amendments include the incarceration amendment, which many of you are probably aware of. It was submitted to CMS in November of 2020. And that request was to provide SUD treatment services while an individual is incarcerated, and to also provide case management services 30 days prior to that individual's release. Pending amendments also include a request for a serious mental illness, an SMI Section 1115 demonstration, and this was submitted to CMS in May of this year. And so May of 2023, the request is to reimburse inpatient psychiatric stays beyond 15 days with a statewide average not to exceed 30 days. That same amendment request also included a pilot request for a recuperative care program, also known as medical respite. And so the pilot again would include a recuperative care service for homeless individuals that require additional recovery time following hospitalization and can't be treated in a shelter or again on essentially the street. And so the service will also address health-related social needs, or HRSNs, such as housing, transportation, and employment, and other services that individual may need. And so to give you a little framework regarding the justice involved individual population in Kentucky. So again, DMS is currently not eligible to provide Medicaid coverage for services while an individual. So that includes adults and youth as incarcerated. So as we mentioned, in November of 2020, DMS did partner with the Department for Corrections, DOC, to file an amendment to our 1115 demonstration and request approval to allow the Commonwealth to reimburse for SUD treatment provided to eligible individuals while they are incarcerated. And again, that was for our adult individuals. And so the application initially included a request to provide similar SUD services that are approved under Kentucky State Plan. So again, the state plan is Medicaid's approved authority for services to individuals participating in the established DOC SUD programs to ensure that those individuals receive the needed treatment and coordination of care 30 days prior to release. And so again, this kind of outlines Kentucky's current incarceration population for adults and youth. But currently, there are nearly 20,000 incarcerated adults in Kentucky, with 41,000 individuals also in active supervision. And again, Kentucky is considered one of the states, the highest in the world, actually, with the highest incarceration population. And so, again, we want to speak a little and provide an overview of the Reentry Section 1115 demonstration opportunity to states. And so in April of 2023, CMS again did release guidance to states regarding what they refer to as opportunities to test transition-related strategies to support community and improve care transitions for individuals who are incarcerated. And so again, we refer to this opportunity as the reentry demonstration. The demonstration allows state Medicaid agencies to receive the FFP, as we mentioned, or that federal financial participation match for expenditures for certain pre-release healthcare services that are provided to individuals who are incarcerated. And again, that is to soon to be released. And so the Reentry 1115 permits states to provide that short-term Medicaid enrollment assistance and pre-release coverage for certain services to facilitate successful care transitions of medical and behavioral health and social, and address those social determinants of health needs at transition and at release. And so at this time, there have been 3 states approved for this full reentry demonstration opportunity. However, those states have not actually been able to implement the approval at this time. And we'll talk a little bit about that implementation process. And so again, the goals of the 1115 reentry demonstration, and again, what the states are required to meet is to improve access to services by increasing coverage. Again, improving the coordination and communication between the carceral settings and community providers. Reducing the number of emergency department visits and inpatient hospitalizations, and to increase, again, additional investments in healthcare and related services. So under the demonstration opportunity, states can choose a broadly defined demonstration population. So again, that can include all soon-to-be former incarcerated individuals, or the target, or excuse me, or states can target populations covered by the demonstration to individuals with specific conditions, such as those with substance use disorders. And so the opportunity requires collaboration with the correctional facilities and agency partners to start the Medicaid application process upon incarceration. So at the time that that individual enters into that correctional facility and system, and again, no later than 45 days prior to release. And so states are required to suspend Medicaid eligibility rather than terminate individuals' eligibility at the time that they become incarcerated. And again, this is something, a process that our state already follows and implements in regard to an individual when they become incarcerated. The pre-release timeframe, the reentry 1115 can include flexibility for states to offer coverage for the certain pre-release services 30 days before the incarcerated individual is expected to be released, but states requesting more than 30 days, and it can be up to 90 days, do require negotiation with CMS, and again requires the state to demonstrate related hypothesis how going beyond 30 days improves care transitions for that individual or for those individuals. And it is important to note that it is clear to states that CMS will not approve more than 90 days pre-release. And so there are 3 required services under the demonstration for states that apply and do participate. And that is case management to assess and address physical, behavioral health, and health-related social needs. So again, those HRSNs. Also to provide medication-assisted treatment or MAT services for all types of SUD. And that includes the medication and counseling. And again, a 30-day supply of all prescription medications prescribed for the beneficiary at the time of release from that correctional facility. And so additional services requested by the state must demonstrate likeliness to improve care transitions upon reentry. And again, it is important to note that full state plan coverage of Medicaid benefits is likely not to be approved by CMS at this time. So again, really those selected services. States must develop a readiness plan for each facility, correctional facility that's eligible under the demonstration, to ensure that those facilities are able to provide all services that are covered under the demonstration and meet the enrollment and system requirements. So again, if the state is approved for certain services under the demonstration, the facilities such as prisons, jails, youth detentional centers, etc. Those facilities, all of those facilities must be able to provide all of the services covered under the demonstration, not just select certain services. So that's important to note as a requirement as well. And so also want the public to be aware that CMS, and this again is new to Section 1115 demonstrations, but CMS will not approve a federal match for expenditures for any existing services or healthcare services that are currently funded with state and or local dollars unless the state agrees to reinvest that amount into new activities or new initiatives to increase access and improve quality of healthcare services for that individual who is soon to be released. And so reinvestment funds, the state again is required to reinvest the existing, the match of the existing funds and programs, and they should be used to support successful transitions of the beneficiaries to the community. And so examples of how the states may utilize that reinvestment opportunity is to improve access and capacity to behavioral and physical health services in the community and in the within the correctional facility. Again, it can be to improve the quality of services and access to services, improve health IT and data sharing among the correctional facilities, the state, community partners, etc. And again, also used to expand and enhance community-based services that support the needs for the justice-involved individuals. And so it's also important to note as the state looks at what is considered existing versus new services to determine what that reinvestment plan would look like. Existing services are existing expenditures and should be considered the existing expenditures for services currently provided by the carceral setting or facility. So those are subject to reinvestment into the reinvestment dollar and plan. And again, new services that do not require reinvestment, those are new expenditures for services that are not currently provided by the correctional facility. And it can also be expansion of services within the carceral facility. So those do not require reinvestment either. So for an example, within the state prisons, say that there are select prisons that offer MAT services currently. If the state, again, under the demonstration is required to provide that service across all of those locations, if they're included in the demonstration, the expenditures to expand those services and meet that requirement under the demonstration, again, are considered new services, and those would not be subject to the reinvestment. Okay. So we want to speak a little bit to what is the state's approach to expedite an approval for the application and for our waiver request. Again, as we know that the need across the state is very great. We do want to mention that based on the guidance in conversations that Kentucky's pending incarceration amendment that we've spoke to submitted in 2020 will not be approved as is. And so with this application, an intent to submit, Kentucky will withdraw its original incarceration request and submit a request for a reentry 1115 demonstration to align with the CMS guidance. And Kentucky's reentry waiver request, again, is based on a set of complex and interrelated variables. For Kentucky, again, is very aware its incarcerated individuals face disproportionate rates of mental health issues, SUD disorders, and physical complications as well. And the barriers that these individuals face upon reentry, we understand that this again just further exacerbates the underlying health conditions and complicates again the outcomes for those individuals, both for the individual and the community. And so Kentucky aims with this request to align with CMS guidance in hopes for a timely approval to begin addressing these needs and barriers of the justice-involved individuals. and implementation of the reentry demonstration. Again, this includes a complex system change across state agencies and communities. Excuse me. The initial request allows Kentucky to begin planning the implementation and to ensure that the program is successful as we develop and learn across our systems. And again, we also note that Kentucky can amend its opportunity as we expand. Okay. And so we want to speak to a little bit of what Kentucky and Medicaid has done this far in terms of stakeholder engagement and activities, which is really important in a successful submission to CMS and implementation of the program. So DMS completed stakeholder and focus group interviews in September of this year. And again, this was to map the current process for providing services and supports to the reentry individuals, and also identified these activities identified gaps in services available to the individuals returning to society. And it allowed us to explore barriers and challenges to providing services and to individuals upon release into the community. But it also allowed us to identify best practices. And so again, agencies were able to, and even individuals with lived experience were still able to provide feedback in regards to what is working and what is existing. So what is the existing infrastructure in our state today that we can leverage and have to build on in this implementation and opportunity? So next we'll speak a little bit to what is the waiver design and what is Kentucky's request in the application. Kentucky's request, again, will include coverage for the adult and juvenile populations. The carceral settings will include Kentucky state prisons and the Department for Juvenile Justice, DJJ, their youth development centers, also known again as referred to as the YDCs. So services requested under the demonstration for both the adults and youth will include case management services, 60 days pre-release and 12 months post-release. So these services include a comprehensive assessment of need for any medical, behavioral health, and the health-related social needs that include housing, education, employment, and again, other services. Case management also will include development and a revision of a specific person-centered reentry plan that's based on the assessment. The case manager is also responsible for linking, referring, and coordinating the soon-to-be released individual with the medical, behavioral health, social providers and programs. And so for those services to address those identified needs outlined in the assessment, and again, help the individual achieve the goals that are also included in that specific care plan or transition plan. And so the transition activities, again, they can include the scheduling of appointments and transportation, et cetera, to help that individual obtain the needed supports and stabilization services in the community and at transition. So again, some of the services that could be arranged are physical exams, any consultations that individual may need that could, again, have been brought to attention during any of the screening and assessment, pre-release, any follow-up lab work that is needed, screening for suicide, risk of overdose, again, continuing medication-assisted treatment, providing those peer support services, connection to peer support services, and et cetera. So again, many of the same case management roles as we're used to. Again, the services will also include medication-assisted treatment. As noted before, that is medication and counseling 60 days pre-release. And then again, as that individual transitions into the community, ongoing as needed, and a 30-day supply of medications at the time of release. And also do want to note that part of the case management plan in services is also identifying any of those durable medical needs of that individual and ensuring that they have those scheduled and available at the time of transition as well. And so for the adult population, we do also want to mention the request does include a request to cover recovery resident support service. And so that's going to be referred to as the RRSS. And so that request will be included up to 90 days post-release. And so the residential resident support services is not specific to the reentry demonstration. It is requested for individuals with SUD that's included in the reentry population and would meet that criteria, but also for the individuals that are participating in Senate Bill 90 through the Behavioral Health Conditional Dismissal Program. And so the RRS service, again, would be a service that could be provided to the individuals that meet criteria for the service and provided by recovery residents, providers that meet criteria as well. And so the services that are requested can be delivered in person or via telehealth. So what does the timeline look like for request approval and implementation? And so we do want to speak a little to the planning and program development beyond the submission to CMS. And so Medicaid will be establishing Kentucky Acres. So again, this is the Advisory and Community Collaboration for Reentry Services. And so again, it's a lengthy acronym, but Kentucky Acres. And again, this work group is going to be to support the reentry program planning and implementation efforts of this initiative. And it's the primary source for feedback and utilizing the expertise of the individuals of this work group from our state agencies, community partners, and individuals with lived experience. And so this, again, the Kentucky Acres will be responsible, again, in overseeing the decision-making to help build consensus around key issues that impact the policy development of this program, or procedures and protocol implementations, IT system integrations, and again, to support that pre and post-release services and healthcare linkages. So a few of the things that, again, the work group will be responsible in assisting the department with and collaborating with is regarding the eligibility and enrollment changes for this population, what, again, the implementation of the service package and benefit design, the provider enrollment for the providers that would be providing these services pre-release, and again, the data exchanges we spoke to, and the system changes as well to implement. So Kentucky is required to submit a monitoring protocol. This follows the demonstration approval. And so monitoring protocol, again, is standard in any of the Section 1115 demonstration approvals, and it outlines Kentucky's approach to reporting progress and ensuring that the program meets integrity and oversight and monitoring of performance metrics. And this, again, is where the state is required to submit to CMS quarterly and annually reports of the demonstration. And the monitoring, like we said, again, is very important to ensure that the state's meeting the demonstration milestones and benchmarks that is established. So along with the monitoring protocol, the state is also required to submit an evaluation plan. So again, the state will also contract with an independent evaluator to complete this evaluation of the program, and that's required under all of the demonstrations as well. And this, again, is designed and implemented following the approval of the application. And so what you see here again, and this is important to remember that this is a hypothetical timeline, and this is an effort to be transparent regarding the approval and implementation process of not just this waiver, but any of the Section 1115 demonstrations. So there is not an established time frame for 1115 approvals. And so the review process and negotiation period really varies among each request from each state based on several factors. And so it's just important to note that once the application is approved by CMS, that the states are then required to submit, as we mentioned, the implementation plan and monitoring protocols. And the implementation plan must then be approved prior to the state being able to actually implement the program and go live. So again, this is very hypothetical, but we just want, again, the public to be aware that we are excited about the opportunity. We do intend to submit the application to CMS by the end of the year. However, it is really unknown as far as the review process and timeline from CMS to when an approval and implementation might actually occur. Okay. So as we've mentioned, the public comment period and the state is currently in a public comment period. It will be held through December 9th. And so we again encourage everyone to view the full application that is posted on the DMS website. And then again, those links are noted here on the slide as well as in the chat box. And so we would encourage everyone to view that application and to make comments. But as a reminder that all formal comments should be submitted to the state on or before December 9th. And so again, today we wanted to ensure that you had an opportunity, excuse me, to hear an overview of the application and what the application entails, but we do encourage you to view the full application online. And again, let us know if you have any questions about that, but any questions that we do gather today, we will follow up, but again, we want to ensure that we capture them all and include that in the response to the public. And so all the questions that we do collect will be posted online as well as provided back to you in a response via email as well. But also please note that you can send comments email to the address again that's listed on the slide or in the chat box, but they can also be mailed to the department also. So again, if there are general questions regarding the demonstration process that we talked about today, or the application, you can submit those to the Reentry program email box that's listed there. If there are questions about Medicaid behavioral health policy in general, we also want to include and make sure everyone is aware that there is a DMS.issues mailbox that's monitored by the behavioral health team. And so you can also submit those using that barcode scan also. And so the department appreciates everyone's participation and interest in the reentry demonstration opportunity. And we are very excited about the opportunity to support the individuals returning to society. And again, that the impacts of this approval and this application could have on improving this transitions for these individuals. And so we also, again, remind everyone and is aware that implementing the demonstration is going to be complex and extensive. It is a change to not only Medicaid, but to our state partners and agencies as well. And so the department's hopeful that this request, again, lays a timelier uh, uh, groundwork and a building block for expanding the opportunities under the demonstration, again, as we grow and learn and to ensure that the program is successful. So we want to thank everyone again for joining us today. This does include today's forum. Again, please if there were any questions noted in the box, we'll take note of that, capture those, and reach back out to you individually as well. But again, we want to encourage you to make any of those formal comments if you have had an opportunity to review the draft already to the appropriate channels that we discussed. So thank you again, and everyone have a good afternoon and rest of the day. Thank you.